Hi, my name is Hanna, and I'm the lead pharmacist at the Northern Ireland Ambulance Service. I led the review of the Naloxone monograph, which sits in the medicine section of the JRCALC Plus app. The guideline has been updated to the new medicine standardised format, so it now includes factors to consider such as pregnancy and breastfeeding and a specific monitoring section. A significant change is the removal of the indication to give naloxone for patients with confirmed cardiac arrest. An International Liaison Committee on Resuscitation and European Resus Council evidence review concluded that there is insufficient evidence to recommend any additional opioid-specific therapy in adult or pediatric cardiac arrest secondary to suspected opioid poisoning. The emphasis remains on high-quality CPR and standard ALS. Naloxone should be given for the reversal of acute opioid or opioid toxicity for respiratory depression or respiratory arrest with cardiac output as detailed in the current Altered Level of Consciousness, Medical Emergencies Overview and Overdose and Poisoning Guidelines. For end-of-life patients, we have lowered the initial dose and included a dilution to aid titration. The evidence suggests titration helps to balance pain relief whilst reversing respiratory depression at end of life. The monograph also includes a dosing regime for naloxone administration in suspected synthetic opioid overdose. This follows the update from the National Poisons Agencies, as synthetic opioids have a high affinity for the opioid receptors. So they join the receptors strongly and they are hard to knock out. That means that higher amounts of naloxone are required and repeat dosing may be required more frequently than with other opioids. In practice, if a patient is responding to naloxone administration but reverts to respiratory depression, the dose should be repeated as required with no maximum dose. This monograph also includes additional preparations that are carried by some services and specialist teams. So the monograph has undergone the general standardisation process. The update in indications is to reflect updated evidence and safety bulletins. We have also taken advice from specialist services such as the National Poisons Agency and palliative care. This update hopefully clarifies clinical practice by streamlining the dosing and adding the information about suspected synthetic opioids to the monograph, and by including practical information on dilution and titration in end-of-life care to help balance analgesia whilst managing the respiratory depression. By removing the indication for naloxone and cardiac arrest, the emphasis will appropriately be focused on high-quality CPR and standard ALS. The monitoring section adds additional information to aid the management of the patients.